Slow rollout to the COVID-19 vaccine. Tonight, most people still don't know when they can get the shot. All of this while the majority of the state's supply remains unused.
So far, the state has received nearly 300,000 doses, but it has used just over 100,000 doses. Our Susan L. Corey working for you, taking a closer look at what's causing the delays. Susan.
Well, Donna and Kevin, if you look at the latest numbers from the CDC, right now, Arkansas isn't the worst state, but we're not the best when it comes to how fast we're getting vaccines out. We fall around the middle, but when it comes to using all of those doses, that's a different story.
For some, the wait is over, while others face hours in line and long lists for appointments.
We're moving as fast as we can.
As a virus known for its quick spread,
I'm not happy with it.
Proves much slower to vaccinate against.
This is a logistics challenge.
It's been almost a month since this day.
I'm excited.
When the first people in Arkansas got their shots. But excitement drops as state leaders realize vaccine rollout isn't going according to plan.
I don't think anybody who wants to get all the vaccinations out can be satisfied with it.
To date, Governor Asa Hutchinson says about 3% of Arkansans got their first dose. That's low, but he believes the state is on a learning curve as it decides who gets the vaccine first.
Some chose not to take that priority, so we're going to move to other priorities.
Even as he expands the list to include teachers and people 70 and older, the latest numbers remain staggering, with around 200,000 doses in storage. Enough to have Lieutenant Governor Tim Griffin tweeting, "Let's get the vaccine into as many arms as possible and use more, bigger venues to do it." But the state isn't making those plans just yet.
We're still early on in the process.
If you ask state epidemiologist Dr. Jennifer Dillahay, there are two other reasons making rollout slow: wasted doses and reporting delays. She says the first can happen when vaccines aren't stored properly, since they have to be kept at low temperatures. Then there's times she says doses just have to be thrown away. That's because these vials hold multiple doses, which all have to be used within a 6-hour window. So if there aren't enough patients lined up, there's waste.
I'm not really sure of the numbers. Right now, there are no penalties for the loss of vaccine, either due to spoilage or wastage, but we would be monitoring that.
Dr. Dillahay says getting a grasp on that is hard since the state can't pinpoint numbers, which leads into what she considers the most problematic reason: reporting delays.
We're having some data transfer issues.
She says pharmacies and healthcare providers have 3 days to log on and report vaccine numbers, a system with glitches.
We have reports of people entering their data and then not coming through, and we're trying to troubleshoot it.
Without the most up-to-date records, she says it's hard to see if doses are sitting in storage too long, but promises a fix soon.
We'll have real-time information as close as possible to where the vaccine is, where and who has extra and where the doses are needed.
There's no exact timeline.
Stay tuned. I think the data will get better.
Meaning more waiting in a pandemic that keeps putting patients to the test.
And some pharmacies and hospitals are using waiting lists to prevent wasted doses. They'll call whoever's available as long as they fall in one of the state's 3 priority groups. As for the state expanding eligibility, that goes into effect on Monday.
I tell you what, when you talk about throwing away doses, that just blows my mind.
You're not the only one.
Because so many people have been waiting for this vaccine, and it's being thrown away. What about a tracking system, Susan, to keep up with who's getting it and perhaps who's not getting it?
And that's a big part of what the state says. They're just hoping to improve, and hopefully within the next coming days, even weeks, we'll see the numbers there getting better. But the state just acknowledging that right now they need to get a better system in place. They need to work out any glitches so that when those vaccines are being given to people, they're getting that real-time information so they can really look and say, hey, maybe this is where we have a gap, or more vaccines are needed at another place.
Yeah.
All right, well, keep us posted. I know you'll stay on top of it like always. Thank you, Susan.
Thank you, Susan.
We'll take a quick break.